Hello everyone! Today we will be talking about prolonged grief reactions subsequent to a reproductive loss, and today's presentation is based on an article, which doi is right here, so if you want to read the article, just type this doi on Google and you'll have access to the article. A significant number of those experiencing a reproductive loss exhibit signs that others can pick up on. However, people can react in multiple ways, often in ways that not even the patient is expecting or understands. We can have a classic presentation of crying, but the truth is that the span of emotions that people can feel is so wide and is so diverse that we'll do a video about this later on. Reactions can also be prolonged, meaning that it's normal to take weeks, months, or even years to feel adjusted and functional again. Reactions can take some time to start manifesting, meaning that patients might not process the event as it occurs or as it immediately ends. Some people take a long time to show the signs most people expect, like crying, and some people don't even do that. Common maladaptive coping strategies include social isolation, disturbed relationships, easily being irritable, and cynicism, and also feeling an inability to relate to others. Starting substance abuse, misuse, or having a use that they already had become more pronounced or kind of stir into abuse. The development of affective disorders, diminished self-esteem and sense of functionality or ability to do things, depressive symptoms or PTSD symptoms, and suicidal ideation. Basically, the person is still recovering from the miscarriage, which can take a while. They can also have sensations or symptoms that are psychosomatic, but also physical manifestations of their psychological state, and especially if the grief is prolonged, they can have hypertension, cardiovascular disease, and even a higher risk of stroke. Also, when someone is sad for a long time, they can have other things like being fatigued, having headaches, etc. Repetitive and or prolonged processes worsen the above symptoms that were mentioned. Among healthcare professionals and society at large, perinatal loss is generally viewed as a less traumatic and its grieving process as less prolonged than the death of an older child or an adult, and bereaved parents often find it hard to reconcile their intense feelings with society's lack of validation. So we have numerous people who are mourning their loss in secret, and many have feelings of shame or frustration, which then leads them to not want to share their experiences. And if patients bring the subject up and their healthcare professional does not handle the situation carefully, then they can lose trust, and this just plays more into the narrative of I don't want to share this with anyone else, I'm going to keep this a secret because no one will understand or validate what I am going through. And more patients are then turning to web-based reproductive bereavement resources. However, these options or the group chats that are created and are not monitored sometimes are not helpful, and they spread misinformation, and sometimes they are not as supportive as we first think that they are going to be. On the other hand, if we are talking about the professional side, exposure to early pregnancy loss on a daily basis may lead clinicians to normalize the experience and overlook the possible profound psychological outcomes and consequences that the patients are going to face. So reproductive losses are typically screened for and recorded. However, due to the nature of perinatal grief reactions, many clinicians may miss or dismiss a grief reaction from a patient. Studies evaluating the long-term emotional impact of reproductive loss have generally been limited to 12 months, and grief reactions delayed in onset are often not addressed. Standardized protocols for assessing the emotional well-being of patients, consisting of follow-up visits or phone calls for several months after the loss occurred, are somewhat common, and however are still not enough. The present study was ran in America and basically did a content analysis of 164 website blogs from female participants who reported having had experienced a miscarriage or abortion in their lifetime. It's just important to emphasize that this was an unstructured self-report, and the data set is not very large. The narratives were reviewed for details regarding the time spent between the pregnancy loss and the composition of the blog post, for subsequent relationship problems, and for detrimental mental health conditions. Maladaptive reactions were contrasted for those that indicated a greater than 12 months time lapse and those who had not. And now we are going to talk a bit about what these authors found. So mental health conditions attributed to the reproductive loss by those reported longer bereavement times included subsequent relationship problems, substance misuse, depression, suicidal ideation, and PTSD. Then it's also important to see some differences in percentages. So we can see a higher percentage of reports of maladaptive issues in participants who reported that a year or more had passed since the loss of their pregnancy when compared to the same reports, but for participants who said that they had less than a year pass since the loss of their pregnancy. So when time goes on, we can see more maladaptive issues being reported. 39.6% of the women reported in their narrative that at least 1 year or more had passed since experiencing the miscarriage or abortion. So this is quite a lot of people that then also reported having maladaptive coping strategies. The median time spent between the loss and composing the blog was 4 years with a range of 47 years. And I took this quote from the study because I thought it was quite impactful. So 13 years later, and I am only peeling back the top, or maybe the middle layers, of an onion to understand it and heal. But I don't believe the pain will ever stop. Before getting into a bit more detailed reports and results that I found interesting, I just do want to say that when we think that time heals everything, that's not true. Time does not heal everything. Sometimes time just exacerbates things that are difficult for us to deal with and live with and cope with. And sometimes time makes it worse. So do not just think that the healing comes from being distant to what happened, because that distance sometimes is not measured in time or in physical space. And sometimes we cannot choose what we think about and what we feel, and we cannot distance ourselves from what happened. And the truth is that every single thing that happens to us makes us who we are. And so it is necessary to explore that and have some peace with that happening. So now we are going to talk about maladaptive partner or parental relationships. 26.2% reported discord or dissolution of intimate partner relationships, which is a very high number to have. And subsequent relationship changes were described in varying degrees, ranging from discord to divorce to abuse. So we have different scenarios happening. Out of the women who reported that their reproductive loss occurred more than a year prior to composing their story, 36.9% report that they experienced intimate partner discord or dissolution. Parental or familiar relationship discord was only reported for those blogging about their abortion experiences, and 2.4% of narratives revealed strain or distress in relationships with subsequent distress when dealing with their own children or when being around others with children. And 2.4% seems like a small percentage, but the truth is that if this happened even to just one person, is one too many. Tension in relationships subsequent to early pregnancy loss was attributed to the ambiguity of the loss, lack of acknowledgement and support from loved ones, or the absence of that support. Now we are going to talk about maladaptive occupational adjustment, which can mean difficulties achieving educational or occupational goals, absenteeism, and or job losses. and these were reported occurring subsequent to or exacerbated by the experience of the pregnancy loss. 6.7% reported having these. Now, regarding subsequent substance misuse, we can say that this includes the disclosure of alcohol, cigarette smoking, and illicit drug misuse in the narratives that were reported. Of course, there are other possible substance misuses that were not included in the present study. This was reported in 5.5% of narratives. Now, regarding clinical guidelines for the routine assessment of maladaptive reproductive grief reactions in outpatient primary care, we can say that early pregnancy loss, whether miscarriage or abortion, should be approached holistically. So we should have the evaluation of the emotional response to the loss that the patient shows. We should have a praise regarding the reproductive grief. We should have an effective assessment of maladaptive responses. We should try and initiate treatment at subsequent visits, and we should have follow-ups, if not in person, then via phone calls. We should have ongoing assessments and evaluations of distress related to pregnancy loss, and also related to how the day-to-day life of the patient has been in regards to that event. It's important to understand that satisfaction with healthcare services at the time of the reproductive loss and subsequent follow-up visits is integral for a healing grief trajectory. Now, regarding what tools you can use to screen for reproductive grief, we will talk about this in our next video, so stay tuned. Now, just to talk a bit about how you can start thinking about your own narrative, or how you can start thinking about other people's narratives. Here are just some tips on how you can approach this regarding abortion and regarding miscarriage. So I would invite you to pause the video and read through these if you are interested. And this was our video for today. Thank you so much for listening. And again, if you need anything and you don't want to make a comment, then you can write to me. You can reach me via beatrice@efp.clinic or through my Instagram account, Beatrice_Regina_fertility. Thank you so much.